Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us this morning for another segment. Going to be speaking with returning guest, Dr. Jacqueline Nicholas. She's joining us to talk about MS, multiple sclerosis. Now, MS affects over 1 million people here in the United States. It's an unpredictable, sometimes disabling disease that disrupts the flow of information between the brain and the body. But I'm going to let Dr. Nicholas tell us more about MS. Welcome back to Health Professional Radio, Dr. Jacqueline Nicholas, and thank you so much for taking the time.
Hi, thanks for having me today. So I'm excited to talk to you today about relapsing MS and a new treatment that we have that's FDA approved to treat relapsing forms of multiple sclerosis.
What traditionally has been the go-to treatment for MS?
So fortunately, since the 1990s, we've had multiple treatment options that have been FDA approved, and they range in terms of their effectiveness as well as the route of administration. This pill is a once daily oral pill for MS called ZEPOSIA.
So first, what exactly is MS? I tried to explain it, but what is MS exactly, and why is this new FDA approval so important?
Yeah, you did a great job with your description. So MS is an autoimmune disease where somebody's own white blood cells actually attack the coating on their neurons in the brain and the spinal cord. And that coating is called myelin. And when it's damaged, it makes it hard for signals to travel along the neurons. And people can have a number of different neurologic symptoms, including weakness, numbness, difficulty walking, bowel bladder problems, memory, and even fatigue difficulties.
Now, aside from being, you say a once daily, is there a once daily oral treatment? Aside from that, how is this significantly different from some of the treatments that we talked about from the 90s?
Yeah, so this is an oral pill that patients can take in the convenience of their own home. As compared to some of our other options, it actually doesn't require any monitoring when people take their first dose. There's no genetic testing requirement. And for most patients, they don't have to get ophthalmologic or eye testing prior to starting.
What was the significance of that testing that no longer is required with this treatment?
So with some of our medications, there's a risk of something called macular edema, which is a swelling in the back of the eye. And so for individuals who don't have those issues, they don't have to have that pre-testing. There are other medicines that require some special testing. This one really for the first dose prior to starting, they have to get basic blood counts, liver function test, they have to get an EKG or a heart rhythm test, and just review their medications and vaccines with their physician.
Now, are those things that you just mentioned, are those kind of standard operating procedure before undergoing treatment for MS or considering treatment for MS?
They sure are. So it's very common that with the majority of our therapies that there's some basic blood testing and other testing that's required just to make sure that they're safe to start that medicine.
Is this new treatment something that eliminates the need for that because of the way that it works?
Yeah, so this treatment, because of its safety profile, that's why the FDA has approved it without a first dose monitoring of the heart rate.
Okay. Now, when all of this testing, as you say, is kind of standard operating procedure, who is the appropriate candidate? Who, once all the testing that you have to do is done, who's the appropriate candidate for this recently approved treatment?
So this would be anybody who has a relapsing form of MS. So that encompasses relapsing remitting MS, clinically isolated syndrome, and something called active secondary progressive MS.
Active secondary progressive. Now, is that a more severe form of relapsing?
So when we look at individuals who come in at initial diagnosis, the majority of individuals start out as relapsing remitting MS, so that's about 80 to 85% at the time of onset. But then by about 10 to 20 years, the majority of folks go on from relapsing remitting to become secondary progressive. And that's where we see that they're having a worsening of their function outside of actual relapses or attacks.
These the symptoms, are they greatly reduced? Are they stopped for a period of time and then come back as severe as before, or are they reduced in severity over the course of the relapse?
Yeah, so when a relapse occurs, the symptoms can come on and are very obvious, and they're either new or something that's been gone for quite some time and has recurred. Mm-hmm. And when somebody has an attack, sometimes they can have complete improvement, but oftentimes they're left with some of the symptoms of that relapse, and especially over time throughout the course of the disease.
Now, is this treatment good for candidates, young adults, teens, anyone who's diagnosed?
So this therapy was studied in individuals who were 18 or older, and so it's been FDA approved for the use in relapsing forms of MS for adults.
Children or younger than that who are diagnosed with MS, they also have relapsing forms as well. I mean, that's something that is across the board for people suffering with MS?
That's absolutely correct. So about 5% of multiple sclerosis onsets in childhood.
Do you see anything in the works in that direction for the younger age as a result of the study of this new treatment?
Yeah, so certainly over time, many of our therapies that have been FDA approved for adults are later evaluated in the pediatric population and have been found to be effective. So my hope is down the road that we'll have more studies with therapies like this to evaluate for safety and benefit in children.
Now, once again, the name of this new treatment and a website where our listeners can get some more information about it?
Sure. So it's ZEPOSIA, and listeners can check out ZEPOSIA.com. So that's ZEPOSIA.com.
Dr. Nicholas, thanks for coming back and joining us here on Health Professional Radio again.
Thanks again. Great talking with you.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.